Dr. Tom Roselle live right now, 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle live. I am in studio waiting to take your phone calls right here at 888-630-9625. That's 888-630 WMAL, and we're here broadcasting on 105.9 FM and AM 630 WMAL. Brand new venue for all of you, and hopefully we're going to reach more people with Dr. Tom Roselle live. We're in studio every Sunday at 12 noon, waiting to take your phone calls and to give you cutting-edge information. Perhaps you've had a problem. Guess what? We're here to put the fire out. We're here to show you how it can be done without drugs, without surgery, something different for a change. 888-630-9625. In studio, I have a very special guest, and we have a topic that kind of is a far-reaching topic, something that you wouldn't guess would affect so many different systems, something that when it happens is not only immediately a challenge, but can be long-term devastating because things build up over a period of time. Well, my guest in studio is Dr. Scott Lamp, and the topic is whiplash injury. Yeah, you know when you're sitting out in the Washington metropolitan area and somebody comes behind you and creams you, or comes from the front and smashes you, or T-bones you from the side, or even when you don't think it's significant. Oh, I'm just a little stiff. And Dr. Scott is here, and we're going to talk about really what happens in the manifestation, because this Wednesday evening at the Roselle Center for Healing, Dr. Scott Lamp will be your host, and he's going to be presenting a topic of whiplash and the treatment process, what really happens, how come you don't feel good 6, 9, 10, 12 months later. And all you need to do is call our office at 703-698-7117. Tell my staff that you'd like to attend this Wednesday night, September the 28th, evening on whiplash. And I'm telling you, if you've had a problem, you've been putting it off, and now you're taking medication because you're tight and you're stiff and you got a headache and your whole body hurts and nothing's going right, it probably happened when you got rear-ended or hit in some way. Dr. Scott, welcome again.
Thank you. Thank you for the invitation here.
Yeah, it's always fun, because it's an easy flow. We just came off of a great seminar a week ago yesterday, our Ageless Health Seminar, which was a phenomenal success. Everybody that went knows that, we hit it out of the park. I'm really proud of you guys. You did a superb job. I couldn't have asked for you to produce anything more than that. And, sorry that I stuck you with a tag, Dr. Gadget, but
yeah, you did.
You know what? You deserve it. We got all kinds of toys in that office since you've been with us that, we're going to put them in a museum one of these days.
But right now they're still useful. So, it takes a while. Give them a couple of years.
A couple of years, and then they go into the archives. Dr. Scott Lamp's Museum on Gadgets. We're going to talk about something much more important. We're going to talk about whiplash and what happens and, all of that nonsense. Let's talk about whiplash as an overview. Just kind of, really, what is a whiplash? We hear the term, and it's really not the medical terminology, but whiplash means something because of what the body does when it goes through that. So tell us what whiplash is all about.
Well, I think you got to talk about the mechanism. Like you said, hitting from behind. Some people feel like it's a flexion extension injury, but you can get hit from like you're talking about, on the front, from the sides. It's more or less an acceleration deceleration syndrome. So the body's put through a lot of those forces transmitted from the car to the body, and as it goes through and causes a lot of hectic elements to the body in regards to maybe soft tissue, to bone, to the skull, to a lot of different things, and some things you might not even think about, because there's a lot of injuries out there or syndromes that are associated with this whiplash problem.
Well, we look at the human being as this very precarious piece of structure. A person sitting in the chair and the car seat, and they have their head, and encased into that skull is a brain, and from the brain there's a spinal cord that goes all the way down, and there's 31 pairs of nerve roots that go off to all kinds of different places of the body. But this is the originator. This is, we have this whole mechanism that sits, this 12 to 14 pound bowling ball that sits on this neck. Some necks smaller, some necks bigger, but nevertheless, that's the weight of this thing. And it's being supported by sometimes muscles that are strong and sometimes muscles that aren't so hot, and things that have sustained injury over time. But in whipping action. Basically, what we're talking about is the neck, the head is propelled in one direction or the other. It snaps back or it snaps forward, it snaps to the side, or it snaps on an angle. And even if you hit from behind, because of the placement of the shoulder harness, you have an angular impact. The ear comes down and your head goes backwards. But let's set that aside. People are sitting there and we're getting rear-ended all the time, or we're getting hit from the side all the time, and sometimes there's no damage to the car whatsoever. There's just this bump. Dr. Scott, what is the minimal amount of impact that people can say, I better get checked out because I might have an injury or something that's going to come about over time?
I think the majority of people out there and experts are now saying, and you're talking about 5 miles an hour. A lot of people, it's in 5 miles an hour.
5 miles an hour.
And that's not even a consensus yet. But 5 miles an hour is basically what they're looking at, is enough to cause soft tissue injury. Now, a lot of times we're thinking about, a fractured bone. It's going to be a little stronger in speed, but it's a soft tissue injury that can be lingering for years.
So you have damage. You think about football players, and you think about guys playing contact sports of any kind. It's like, being smashed up, but here we are. We're talking about 5 miles an hour. Somebody hits you from behind, just bumps you, and you're not aware of it, and the first thing from behind is your head goes backwards. It crushes. And then when the momentum stops, that's where we get the whipping action. First back and then forward, you have an overstretching of the tissue. So this is where your damage is coming from, isn't it?
Yes, and I think when you think about it, somebody hits you from behind, then when that energy conversion, it's really a conversion of energy. You're pushing that energy goes into the car. Now, the car's not folding up at 5 miles an hour, but you're still moving at the same rate you're being struck. The shoulders move, and the shoulders move even a little bit faster than the car does. And on top of that, through the centrifugal force of the head, that's even going 2.5 times faster than you're being hit. So think about the weight behind that. It's a weight transfer. So you're transferring all that through. Sometimes when the car starts breaking up or starts to fold up, it takes up some of that energy. But at 5 miles an hour, that's not going to happen.
The thing that I tell patients is that think about if you ever were a kid, or even as an adult sometime, I still do it once in a while, get in a Dodgem car. Yeah. And, you're smashing in and so forth. And the impact there is very minor. It's a couple miles an hour at the most.
Right.
But you're getting shaken up.
Oh, yeah.
And here you are in a car. There's a theory called the linear acceleration of energy, where you get hit from behind and the energy passes through the car into the occupant, and it accelerates going up the spinal system. What we don't understand is that if there is no damage to the car, that the energy still continues, and guess where it goes? Into the person in the driver's seat.
Right.
So there's nothing stopping it. If you get a lot of damage, your chances of being injured are actually less than they are if there's no damage.
Right. Because, again, what's being conserved? That folding of the car takes up the energy. But if it's not folding up, where's it going?
To the person.
Right.
Yeah. It amazes me because we watch road races, right? We see these cars, the Indianapolis 500 and so forth, they're going round and round and round, and all of a sudden somebody hits the curve and the car shatters and falls apart, and you watch the guy walk out of the vehicle. It's like nothing has happened to that individual. How come? Well, it's the design. They make the cars to break up like that and take the energy away from the occupant.
Right. And the more it spins, the worse it looks. But let's take an example from somebody who is, there's a large NASCAR following, and the person that passed away that really had a major impact, Dale Earnhardt.
That's right. You
see his car accident. At about 180 miles an hour, he turned and he went into one of those Jersey barrier walls. And it stopped abruptly. There wasn't a lot of throwing of parts and everything throwing off. He died instantly. Because what happened was, with the car spinning, that's taking up all that energy. What happened with him is he had a basilar skull fracture immediately, broke 8 ribs on the left side, left ankle, breastbone was fractured, fatal. It just broke his skull from front to back. Broke also the safety harness and ripped right through it. But it looked like a slow turn into a wall, but it was 180 miles an hour, and nothing folded up.
So that energy went directly to him.
Went into him.
And destroyed his body.
I think to make it more realistic, if somebody were to jump from an airplane and parachute down, and they land with their leg stiff, how would that feel to you?
You're done. I mean, you land with your legs stiff, and you're going to break everything.
Right. But if you land and roll, what happens?
Minimal injury.
Yeah, you're rolling. So kinetic energy from the fall gets converted into heat energy from the muscles working like springs. You get up and walk away.
You know, here's a thought process in one that I've used with patients before to visualize the type of impact. You take 2-gallon containers, and actually 4 of them. You take 2 plastic gallon containers and 2 glass gallon containers, and you put water, fill them up in each. And then you take the 2 plastic containers and you smash them together. The water careens off the sides of the plastic because there's give to the plastic, and it can take impact where there's enough give it doesn't break. But you take the same capacity, the same volume of water, and put them in glass containers, and you smash them in the same force as you did with the plastic containers, and what happens? The glass breaks. Mm-hmm. So you have, here you have injury to the glass, and you can actually reverse it. So let's take the car as the glass container.
Okay.
Right? Now, the glass, when you break the glass, takes away the energy. The water just drops out.
Right.
If you take the plastic and you smash them together, the water smashes all over the place. Guess where the energy goes? To the water.
Right into the water.
That's right. So now you got a problem. This Wednesday night, I know you're going to get into this much more specifically because people suffer dramatically from this, this type of thing. If you'd like to join Dr. Scott this Wednesday evening at the Roselle Center for Healing, the 28th of the month, 703-698-7117. That's 703-698-7117. And how you talk to us here is 888-630-9625. Dr. Scott, talk to us a little bit about the different symptom processes that are associated with an injury, a whiplash injury, whether it's minutes or even days, and sometimes even several months later they show up. What can people expect?
Well, if we're talking soft tissue, you could have a pinching, a twisting, a stretching of a nerve. And so what happens, you can create what they call microavulsions also in the muscle tissue.
Tearing.
And what happens with that is that generally what happens, you get adrenal surge a lot of times when you get to first accident. You get in an accident, I feel fine, but your adrenals are up. The adrenals are doing things to protect you from feeling pain. There's cortisol being put in. It's anti-inflammatory. You don't feel it. 48 hours later, 24 to 48 hours, and I usually find what's interesting with a lot of patients, it's right around 5 o'clock. When they're getting home and starting to relax down a bit, after an accident, either 24 to 48 hours, they start feeling some pain syndrome start washing over them, especially on these small impact type things. Because when the body's starting to relax down and the adrenal surge is not there, all of a sudden the injuries start showing themselves. And these could be things from neck pain to back pain to headaches to jaw problems. And by the way, jaw, we find that about 85% of the people with some accidents like this usually eventually have a jaw problem within the next 5 years. And just amazing how all this seems to escalate. And, I'm looking at here of a list of things that are from, swallowing problems, difficulties. In the cartilage in your neck, you also have an organ called the thyroid. And you can overly stretch that or compress the nerves to that. And that can have a function.
So anything from structural to even endocrine, and I know the result is far-reaching. There's a nerve called the vagus nerve that comes from the brain, goes all the way down, and it hits the heart and the lungs, the intestinal tract, and the stomach, and we can have organ system dysfunction. We're going to talk about those things when we come back. But this Wednesday evening, Dr. Scott Lamp will be your host at our office, and he's going to be doing a night on whiplash injury, and you need to call us at 703-698-7117. You're listening to Dr. Tom Roselle Live. Don't go away. We'll be right back.
Dr. Tom Roselle Live continues now. 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. We are live in studio at 888-630-9625. We're broadcasting to you brand newly from 105.9 FM and AM 630 WMAL. Love to talk to you on any subject that you have in mind. 888-630-9625. Guest in studio, Dr. Scott Lamp, and we're talking about whiplash injuries, those things that go crunch and you don't know where the pain came from. Well, this is the place to figure it out because so many of you have sustained significant motor vehicle accidents or falls or spills or traumas of some sort, skiing accident, playing soccer. The end product is the same. You end up with trouble, and that trouble sometimes is manifested in many different ways, and that's what we were talking about before we took a break, Dr. Lamp. So take us through what happens. Tell us about the symptom processes, as you will, this Wednesday evening, September 28th. You're going to be our in-house presenter on our in-house continuing education program at the Roselle Center for Healing, and if you'd like to attend Dr. Lamp's program, 703-698-7117 is how you do that. Tell my staff that you'd like to be there. You have to reserve the seat. There is no charge. However, we only have limited spacing, so want you there. So let's talk about the biodynamics of whiplash, my friend. Let's talk about what happens, the symptoms, both internal, visceral symptoms, and some other things that go bump in the night.
Well, I think the first thing is when you're going through, and I think a couple different factors that play a part into how somebody gets affected. One is going to be body position, too. If you're relaxed and you're struck, actually the body's more relaxed, so basically there's no bracing, and the less tearing of tissue sometimes happen. But, like you were talking about before, when you have that seatbelt across the front, it's almost like an angular strike. You could have a contusion on the part of the seatbelt where it's attaching to your left side, and then more of a pivot of your other shoulder goes forward, and the snapping, more of a snapping action. So we've got some soft tissue injuries that we look at. We look at the head going back and forth, so the neck muscles get affected. So there's some sprain strains that are happening there. But when you start looking at the supporting pieces, the soft tissue, what starts looking at some of the stronger structural pieces, like the spine itself. And then you get a stretching of the nervous system. And when you start doing those are the things that start creating problems when you have either a stretch or a pinch or a twist on those nerves. You're going to have reactions that are going to be like tingling sensations or numbing sensations that come up. The achiness is going to be things like the muscles tear. And then we haven't even gotten into things like concussions or what happens at the aspect when the skull gets involved and that brain bouncing back and forth. Like, Tom, you were mentioning before with the plastic containers. Good analogy there, where you're pushing back against something, the water slushing back and forth. That could be your brain slushing back and forth inside that, inside the cranium, and a lot of different neurological aspects that come off of that.
And the subtlety is one of those things that we're not aware of, because all of a sudden down the road, your process of mentation, your ability to word find, if you will, can be affected. You know, several years ago, I was involved in a very significant car accident. Sue and I were at the corner of Eldon and Herndon Parkway, and it was 11:15 at night, and the short end of the story was that somebody hit us straight on, no running lights, a Dodge Ram, and they had him clocked at about 50 miles an hour. Well, we won't go into the story, but both of us were injured significantly. Sue had her rib cage separated, her neck was involved, her breathing capacity was impaired. I ended up rupturing a couple discs in my neck and other things. But what I noticed, and people who didn't know me may have not picked it up, but I was having significant problems with articulation, particularly with trying to come up with sentence structure that was something that I could express freely, easily, unlike my normal day-to-day. So how does that happen?
Well, I think it's when you accelerate forward and you get accelerated and whipping back, the brain actually is bouncing back and forth inside the skull. You have water in there. You have, or I should say, cerebral spinal fluid, and it acts like a water balloon and buffets, but it protects you just so far. And when you start bouncing back and forth, you can get some things that are even simply like I would say a grade 1 concussion. And a grade 1 concussion is, by definition, is no loss of consciousness. It's a transient kind of confusion. And the symptoms clear in about 15 minutes, and people don't even think they had a concussion. But the brain's bouncing back and forth. And what happens over a long period of time? We're concerned about things like Alzheimer's and those kind of things. These kind of things add up to damage to our mental faculties.
Well, fortunately, I was able to get rid of it pretty quickly, thanks to you and the other docs in our practice. But if it hadn't been for that, I would have been in trouble.
Dr. Tom Roselle Live continues now. 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are in studio, 888-630-9625. That's 888-630 WMAL on 105.9 FM and AM 630. Waiting to take your phone calls. We're talking about whiplash injury and how profound the effect is throughout the entire body. My guest in studio, Dr. Scott Lamp, who is going to be your presenter at our in-house continuing education program this Wednesday evening, the 28th. If you'd like to join that program, and it is a courtesy to the community, all you have to do is call us at 703-698-7117. Tell my staff that you'd like to be there. Roselle Center for Healing is located on Arlington Boulevard, just off the National Capital Beltway, on the outside of the Beltway, and virtually a third of a mile, so we're very, very convenient to get to. We'd love to have you as our guest, and all you need to do is give us a call. We're talking about whiplash injury, but Dr. Lamp, we do have some calls, and I'd like to go to the phones just for a minute. Is it Nita that's waiting for me? Hello? Hello? I think we lost her. Anyway, we had somebody that called on Lyme's disease, and if you would like to call back, I'll be more than happy to take that and talk to you and answer your question. But in the meantime, Dr. Lamp, let's go back and talk a little bit about what the visceral complaints are. You know, we talked about you get hit from behind and the body gets smashed up, and you can have concussion and apraxic problems, word-finding difficulties, all kinds of things. But we can also have far-reaching effects. We can have things that people wouldn't even think about. What are some of those, and how do they show up?
Well, one of the things is one of the top problems that people have symptom-wise is constipation. And you think about what's constipation going to do with a whiplash injury. And what happens is you got to take a look at some of the nerves and structures that are involved. A lot of special things come out from that head, and one of it is called the vagus nerve. And when you do the vagus nerve and you irritate that, it affects things like your diaphragm. It can affect things like breathing. You could also get in things like, for example, the heart itself. And you could have problems with arrhythmias from that. There's also aspects with the constipation. You can also have some problems with, again, can't get things moving through it. You can't understand why. You could even have some problems as far down into the low back. And all those spots in the spine, from the neck all the way down, remember, all those nerves come out to not only just the muscles, it goes to different organs. And each one of those can be affected in different ways depending on how it's stretched and pulled at that particular junction.
It's amazing to me that a patient comes in and they'll talk about whatever symptoms from gastrointestinal problems. In the reverse, not only constipation but irritable bowel syndrome. When the nerves that go to these organ systems are compressed, irritated, stretched, in some way disturbed, the symptoms that are associated with their targets begin to show up. We talked about that vagus nerve going down, the parasympathetic nerves that come from the spine, and how they, you know, if they're not working, there's going to be significant input. Let's talk about allergies, for example. This is something people wouldn't think about. You know, allergic reactions only happen in the spring or only happen in the fall. But the truth of it is, you can be allergic to a lot of different things. We just got done treating a great young lady by the name of Raylyn, and that we did on MTV, and she was allergic to everything and was on 5 different medications. We got her off of everything, and she got her life back. She was living with an EpiPen constantly. But how do things like, and by the way, there was a traumatic component to this when I was doing her interview that everybody missed, and it was a cranial injury due to a boating accident. And when Raylene comes back from school, I'm going to have her on the program, and she's going to talk about that. But how does that happen?
Well, again, you're looking at the vagus nerve, and again, it's going down and affecting the stomach itself. And one of the things that's important about the stomach is you got to break things down. And even when you breathe in and when you swallow something, it's going to get into the stomach. And if those things don't get broken down, it gets into the body, kind of like a leaky hole gets in, you know, like a leaky boat. Some of the stuff leaks in, and all of a sudden the body's becoming hyperactive. It doesn't like this large substance coming in. And this goes all the way back. If I have an injury, I irritate that the relationship to the stomach then itself doesn't process things well, and then there's large pieces coming down the pipe that are not supposed to be there, and the body overreacts. All of a sudden I got an allergy.
Yeah, it's amazing. If you can figure it out and you can turn the system back on, so to speak, the body begins to work let's hold that thought for process, and we'd still like to invite you this Wednesday evening, the 28th, at the Roselle Center for Healing. Dr. Scott Lamp will be your host. We'll be there to answer your questions after the program as well. We have limited spacing, but give us a call at 703-698-7117 this Wednesday evening, September the 28th. Let's go to the phones. Margaret, thank you for calling. How can I help you?
Yes, hi. I have some friends who are on the Exelon Patch for Alzheimer's and Parkinson's.
Yes.
And I'm wondering what an alternative would be for that.
Well,
they're in their 80s, two ladies that I know.
How advanced?
Not very advanced, I don't think.
Okay, first...
They have past memory, but not much present memory.
Are they at the place where they've lost the ability to know what certain things are for, and they sit there and look at things, or they get lost very easily?
Well, like for instance, one of them today, she was starting to speak, and then she couldn't remember the rest of her sentence, the rest of her comment. And the other one still has spunk. She was kind of sassy woman, and she still has that spunk about her.
Well, we're talking about the treatment of any condition from a point of view without drugs or without surgery. The Exelon Patch is a time-released medication that gets into the system and has multiple layers, in how it works. And we're not going to talk about the allergic reactions. There's some safety effects. There's some problems with it. It's a problem with patients who are allergic to different types of ingredients that are within. And since we're not doing that on the show today, I'm just going to tell you that any kind of patch, any kind of therapeutic application is a problem in this situation. However, nausea, vomiting, diarrhea, loss of appetite, loss of weight, all of those things can be associated with the Exelon Patch. And so you have to weigh the outcome with any of these things. When you have a patient who's in full-blown Alzheimer's, Parkinson's symptoms are also worsened with this patch. Tremors can be worsened with the patch. The dementia patients that are treated with the Exelon Patch have to be very carefully monitored. People with serious lung condition and breathing difficulty and bladder problems and seizures also will have problems, and the dosage has to be titrated very, very specifically. So, but when you treat, we could talk about dementia problems and Alzheimer's for the rest of the program, and the things that can cause them, from heavy metal exposure, particularly mercury and aluminum, and different exposures, electromagnetic fields, and the inability of the body to be able to get rid of these things. In our practice, and as we work in conjunction with other physicians as well, we look at the accumulation of toxic loads and toxic metals, and whether or not they can be chelated out. And there are certain herbs. But to take and say, listen, do this across the board for everybody in all situations would be foolhardy. Low energy light laser along with acupuncture is a piece of the puzzle and can be very effective. I know that I'm not giving you exactly what you want, but I can't do that because, again, we don't know what the underlying triggering mechanism is. When a patient's being treated from a medical point of view, they're kind of using a broad-based, compartmentalized approach to the situation. But I would be very careful with the Exelon Patch, and if I knew more about the individual patients and their history, which would entail some laboratory work that traditional medicine doesn't do, I could be more specific for you. I hope that doesn't confuse you totally, Margaret, but if I can be of help, get a hold of me through my website at rosellecare.com, and I'll give you more direction. I'll tell you people who might be in your area that might be useful. You have an acupuncture school out there, and they do a lot of herbal preparation. Thai Sophia is the name. You're out in Columbia, Maryland.
Yes.
They may be of use to you as well, but get a hold of me, rosellecare.com, and you and I will go back and forth.
Yes, thanks. I was wondering if chlorella would be a helpful detoxing agent.
Chlorella is a very nice detoxifier, but in this situation, I think it might be too mild. It's not going to get in there, and it's not going to grab the heavy metals the way it should. Chlorella does help detoxify metals, but it doesn't do it as profoundly as a chelator would be. Things that go far deeper into the body. Captamare, which is It works like EDTA. It's a DMSA product. It gets in there and actually grabs things out of the neurological bundles and starts dumping it. Corella works more with the soft tissue.
Okay, thanks. And I thought DHA might help.
Yes. Well, that's for any kind of cognitive pattern. It'll increase cognitive function with anybody. But again, you're talking about things that have caused damage to the brain and damage to the neurological communication. You have to look at all the brain chemistries from epinephrine and norepinephrine and so forth, and what that really does. You look at GABA formation. So it's a whole. It's a very specific look. So, again, I'd have to know much more. But some of those things they're too mild to work in this particular situation.
Okay, great. Okay, well, they're not having nausea, vomiting, or loss of weight. These are two sisters, and they've both gained a little bit of weight.
Well, it's a good thing, but you're going to have to be very, very careful in doing any of these things. But anyway, get in touch with me, and I'll be more than happy to help. Thank you, Margaret. We see... unfortunately, cognitive problems that are non-Alzheimer's, like in car accidents, in whiplash injuries as well.
Right, and I think, like we're talking about that post-concussion aspect that happens, and we see a lot of these, and just going to give you an idea about some of the associations with that. I mean, we've got memory loss, kind of change in personality that can happen from some of these things that you don't realize it's so easy to get into. I'll give you an idea about what that would be is like... we've got lack of alcohol tolerance. That'd be one. Headaches would be another aspect that happens with that. Another thing, and I think I remember when going back to Ages Health, and it's one of those things that one of our other colleagues in the office, Dr. Browning, was talking about, is, can you put your hand up and does it shake a lot? And after several injuries and blows, a lot of the things that happens in the neurology of our bodies is to inhibit certain types of modes. Most of our things we do from our brain and nervous systems is to keep things from happening. It stops certain things from happening. And so when you have things like Parkinson's or Alzheimer's and things, you get a lot of shaking. There's no inhibition. Nothing's to take, like, hey, when I turn this off, everything's kind of like it's been injured and it's not getting that message to kind of hold back. So then that's what happens with the shaking aspect that happens with that.
The interesting thing that a lot of physicians aren't even aware of is that a patient who's hit from behind at 13 to 15 miles an hour, and there's nothing that buffers it, and there's not a lot of damage, by the way, at 15 miles an hour, that energy goes directly to the occupant. We talked about that earlier on. So here's the deal. When it hits from behind at that level, you can get up to 10 gravitational units of force, or 10 G force to the head by the time it accelerates up into that area. The potential for substantial soft tissue damage and brain injury is significant. Now, here's the comparison. A fighter pilot, when he makes a turn, sometimes will get up to 6 gravitational units of force. At 6 Gs, fighter pilot has the potential of starting to lose cognitive function, and at 8, he passes out. So we're not talking about minor things. This is only at 15 miles an hour. So there's definite injury, and diagnosis of head injury can be determined. By the way, when it comes to diagnosis, and we only have a couple seconds before we have to take a break, but here's where thermography becomes a very invaluable tool.
Awesome for it.
Thermographic imaging in soft tissue injury, particularly with whiplash, particularly with skull injuries and neck injuries and so forth, show it up right away where sometimes nothing else will show the injury. It's amazing. And by the way, that reminds me that, thermography centers, if those of you would like to find out more about thermographic imaging, go to thermographycenters.com or call Dareth Painter at 703-943-7248. But it'll give you the indicators and the why and what for behind all of that. We're coming up to a break. Don't go away. My guest in studio, Dr. Scott Lamp. He'll be your host this Wednesday evening, September 28th, at the Roselle Center for Healing. If you'd like to attend that class, 703-698-7117.
Dr. Tom Roselle Live continues now. 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle live on 105.9 FM and AM 630 WMAL. Love to be here at a greater reach to bring you the best information in integrative healthcare. You can always reach us here in studio to talk to us at 888-630-9625. If you'd like to find us off the air, you go to RoselleCare.com. That's RoselleCare.com. Or you can give us a call at 703-698-7117, the same number that you're going to call to register for Dr. Lamp's class this Wednesday evening on whiplash. Question came in when we were taking a break, Dr. Lamp, on can roller coasters cause a whiplash?
Very much so. In fact, actually, I think one of the things when I was researching, and I believe it was called the Cyclone, it was up in Canada, and they used to have a nurse on the platform. And when they first started putting roller coasters, because it was a roller coaster came down and did almost like a hairpin turn, there were a lot of people just having a lot of problems with their neck irritations. And what you'll find out with roller coasters, especially the wooden ones, there's no head restraints. You're just sitting there and just getting whipped back and forth. And those are usually the ones where people feel, especially when you get older, like, I really felt that ride. They're starting to try to get a little bit more intelligent about trying to get things where you actually have a head hardness that you put in, you're supposed to be looking forward. But as you know, as people are having a good time, the roller coasters too, there's a thing called a linear accelerator. Those are the ones that you get on the roller coaster and you blast off probably faster at the ride at the very beginning than the whole part of the rest of the ride. And if your head's turned a little bit and you moved with that, boy, I tell you, there's a lot of possible injuries that's you're exposed to with that.
You know, the interesting thing, and there's a topic that's beat around a lot, and it's called post-concussion syndrome. And with a whiplash injury, you can have a post-concussion syndrome, and the symptoms are significant. They can be very major. You get to a hospital, they check you out, they say there's really nothing wrong with you, got a little bit of strain or sprain in your neck, and it'll go away. Well, not true. We've already told you that nerves can get trapped and so forth. But the increase in frequency, particularly several months out, especially dizziness and cognitive problems and fatigue and visual and auditory problems. And visual problems, your eyes don't work the way you're supposed to. Why? Because the nucleus, the place that the nerves that go to the eyes come from, is right at the base of the skull. And when you get that head smashed up a little bit, you got a problem. And, you know, the thing is cognitive problems tend to persist over a year and up to 25 to 30% of the cases. And there's a lot of studies that bear that out. So we're talking about brain injury, we're talking about nerve root compression, we're talking about visceral disorders, things that can come from very low impact injury. And if you have any of these problems, you want to find out how to finally get yourself around them and resolve it, this Wednesday evening is the night. Dr. Scott Lamp will be your host. Call us at 703-698-7117. Dr. Scott, always a pleasure.
Thank you, sir.
It's always, you know, it's a stimulating adventure with you, particularly when you start bringing toys in the office. And, you know...
You had to get that in, didn't you?
I had to, because, you know, Dr. Gadget is alive and well in my practice, and I'd love to have you meet him. Great guy, brilliant man. This Wednesday evening, the 28th of September, give our office a call. We're here every Sunday at 12 noon, bringing the most up-to-date information, 105.9 FM and AM 630. See you next week. Bye. Health is a do-it-yourself program. That's reality and the title of my new book. This is Dr. Tom Roselle. Health is a do-it-yourself program is a most understandable introduction to natural health care. My book will take you step by step through why the body breaks down and gets sick, but also how it repairs itself. You will finally understand the often confusing world of natural care. Order it today by going to Amazon.com or from our website, RoselleCare.com. That's RoselleCare.com.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.